The Crohn's and Colitis Foundation is a nonprofit dedicated to finding cures for Crohn's disease and ulcerative colitis and improving the quality of life for those with these diseases. I have been involved with the foundation for 5 years, since my son was diagnosed with Crohn's. He is one of millions of Americans, including adults and children living with inflammatory bowel disease, or IBD. My hope is that you, your business, and your employees will agree to provide restroom access to individuals like my son who have a chronic medical condition that requires immediate restroom access.
Crohn's disease and ulcerative colitis cause profound and unrelenting inflammation within the intestines. IBD patients may look fine on the outside, but they can endure debilitating symptoms of abdominal pain and frequent, oftentimes extremely urgent bowel movements. Anxiety surrounding bathroom access is one of the most distressing issues facing Crohn's and colitis patients, and sadly, I've cared for many who have been needlessly traumatized by accidents away from home. This is about more than being able to use the bathroom for my patients. It's about recognizing human dignity, and that's why the Restroom Access Act is important to me.
My name is Allie, and I was diagnosed with Crohn's disease in 2001 at the age of 11. When I was 14 years old, my mom and I were at a store when I suddenly had an all too familiar pain and knew I had minutes, if not seconds, to find a restroom. After learning that the store did not have public restrooms, my mom and I begged the store manager to let me use the employee-only restroom. The store manager claimed he was making a managerial decision and denied me restroom access. Instead, he said I could walk 2 blocks or cross a 4-lane highway to get to the nearest restroom. Crying and bent over in pain, I suffered what anyone with inflammatory bowel disease or a similar illness fears happening to them. I had an accident in the store. This humiliating and debilitating experience is pretty common for people suffering from IBD and similar medical conditions. It is why so many patients plan their days by mapping out where the nearest restrooms are located. And I have heard from multiple people that they are scared to go out shopping or go anywhere in public for fear that there may not be a restroom available. The Restroom Access Act, also known as Allie's Law, states that a retail establishment employee must allow anyone with an eligible medical condition, including Crohn's disease or ulcerative colitis, access to an employee-only restroom where certain conditions apply. The passage of the bill is thanks to a grassroots effort, which in Illinois included members of the business community. Early on in the drafting process, the Illinois Retail Merchants Association and other groups came to the table and helped craft the legislation we have today. We know that many members of the business community want to help, and that a lot of this comes down to more awareness. As Dr. Khan states, this is a human dignity issue. Providing access to a restroom should be common sense. We want to work together to provide that access across the state.
The Restroom Access Act allows customers suffering from Crohn's disease, ulcerative colitis, irritable bowel syndrome, or any other condition that requires immediate access to a restroom, use of the employee-only restroom at a retail establishment under certain conditions. Businesses that are open to the public for the sale of goods or services with employee-only restrooms must provide customers with eligible medical conditions access to an employee-only restroom if 1. A public restroom is not immediately available. 2. 3 or more employees are working at the time. 3. The restroom is not normally available to the public. And 4. The location of the restroom doesn't create an obvious health or safety risk to the customer or the business. The Restroom Access Act also protects retail establishments and their employees from liability stemming from compliance with the Act.
We are encouraging businesses and municipalities to provide restroom access to those with certain medical conditions. Restroom access is a human need which can be addressed by human kindness and awareness of the restroom access legislation. Please educate your staff about Allie's Law and the Restroom Access Act, and how your staff can ensure that restroom access is never an issue. You can strengthen your commitment by registering your restrooms on the Crohn's and Colitis Foundation's We Can't Wait app.